All right, today's September 7th. This is the Makah EOC public briefing. We'll go ahead and get started with your report, Dr. Cope.
All right, thank you, Chief Bruno. Let me pull up my slides. Make sure they're the right ones. All right, well, good morning, everyone. Really nice to see so many attendants at today's briefing. I'm Dr. Libby Cope, the Makah Tribe's Health Officer, and this is our update for today. So we have 19 active cases. We had one new case over the weekend and then one this morning. We've had 64 positive cases total. 45 of those have recovered. 76% of our resident population here in Neah Bay that are 12 and up are fully vaccinated, and 81.5% are partially vaccinated. This is a slide that I used on Friday during the community meeting. You can see on the top right corner, what this slide does is it shows at the rate that we were headed based on the number of cases that we had in September. We were set to have over 200 cases by September 30th. Already we've seen a downward trend and a flattening of that curve. As you can see right now, based on our rates, it's looking closer to 65 cases, which is still an astronomical amount of cases for us, but is slowly lowering that curve, which is good news. And I hope to see this continue to lower as a result of the shelter in place that the Makah Tribal Council has put into effect. Of all of our cases, 23% have been in individuals who are fully vaccinated and 77% in individuals who are not fully vaccinated. This shows a breakdown of that age group, and amongst the age groups who is fully vaccinated who did end up with a positive test for COVID-19. So obviously this first column here is ages 0 to 11. They're not eligible to get the vaccine yet. So all of those cases have been in individuals who are unvaccinated. Ages 12 and up are eligible to get vaccinated, but we've only seen cases in individuals who are not fully vaccinated. And then as you can see moving up, we see somewhat predictably a larger number of individuals in the older age groups. And the reason I say predictably is because as we get older, our immune system capacity for responding to a vaccine and building the antibodies to it goes down, which is why this age group and specifically people with immune compromised status have been targeted for a booster shot to make sure those antibodies stay up. So this shows the age distribution of COVID cases just in 2021. So we had our first COVID case in April for this year in April 2021. And this just shows the breakdown. Up until last week, actually, the majority of cases had been in this age group of 0 to 11. And then last week, due to a number of cases in this age group, it took the lead. But as you can see, it's by 2 cases. So that's that breakdown. Clallam County is continuing to have a very high rate of cases. So their percent positive is 21.3. What that means is that there are a lot of people who are undiagnosed in Clallam County because of the rate of testing. So that number should be at about 2%. And that means that for every 1 case, we have approximately 4 individuals who would test positive for COVID that are going untested. And then I think this information down here, the 3 new recent fatalities, that was as of Friday. That was current then as well. And then the rate per 100,000 is 1,009 cases per 100,000. And if you add this data to this data, that means the rate is actually much higher. But based on what we are seeing with the actual tests that we have in hand, that's the rate, 1,009 new cases per 100,000. High risk is considered anything above 75. So as you can see, that's way past high risk. This graph just shows that number and where we've been in terms of rate of new cases per 100,000. So for majority of the pandemic, we were significantly, or Clallam County was much lower, and now they're way higher here. All right, so this quote was just in the Peninsula Daily News, and I think emphasizes a really important point. The most recent death in Clallam County was a woman in her 60s who was fully vaccinated, but had medical conditions that made her less able to respond to the vaccine and build up that antibody buildup, and for whom treatment was delayed. Dr. Berry, who's the health officer for Clallam County, said there was a significant delay in care due to not being able to find a hospital bed for her because hospitals across the state are near capacity or full, Dr. Berry said. And what I understand is that this person got sick very fast, which is something that we do see with COVID, that someone can go from being mild symptoms to having low oxygen pretty quickly. And so I cannot emphasize this enough. The Clallam County hospitals are full. There will be a delay in care and possible transfer to other hospitals. And that's for conditions that are not related to COVID. So car accidents, et cetera, any trauma, broken bones, heart attacks, all of those things are going to face a delay in care, which is really sad and scary, especially for those who are working on the front lines in healthcare, having to see that on a day-to-day basis. In Washington state, they're seeing this fifth wave as well, but as you can see for the whole state, it's closer to what was happening back in November, December, January. And for Clallam County, as you saw, this is totally new territory for our region. But Washington state is also experiencing this as well. And then in the United States, the trend is continuing to go up. Data, it says here that many states did not report data on Labor Day. So that is expected to be just a blip right there, but the steady rate of incline in fatalities, unfortunately, right down here in the right corner. Slowly rolling in are the results of the genomic sequencing tests, which tell us about the variants. This is increasing quite quickly, the Delta variant. And I expect that there are actually many more Delta variants in Clallam County, but right now it's 101 confirmed. As you can see from this slide, nearly 100% of all genomic sequencing that is done is returning back as Delta. So orange is the Delta variant, and that is by far the most prominent variant that we have here in Washington state. Just a couple of frequently asked questions that we get with case and contact tracing. We have updated a couple of weeks ago our close contact definition to 10 feet, 10 minutes or longer, and any of the individuals involved doesn't have protection, so like mask or other version of protection, like talking through a window, et cetera. Sorry. Just have to close that window. And we did that because we know that there is documented transmission happening closer than 6 or further than 6 feet. We know that Delta is more transmissible and seems to hang out in the air a little bit longer and travel a little bit further. We do not separate families or households. We work directly with families to ensure they're in the most comfortable and safest arrangement possible while they are in isolation and quarantine. This often has to be in a case-by-case basis, and we do provide support and regular check-ins as well as shopping for groceries and other supplies, which were supported by the Makah EOC on that. I included this slide again just to emphasize the large amount of things that we are all doing, hopefully to respond to this pandemic, many of which are preventive and proactive. So getting vaccinated, maintaining that physical distance, wearing a 3-layered mask, washing your hands, avoiding crowds or any kind of crowded environment such as casinos, concerts, busy grocery stores during busy shopping times, et cetera, following the health orders, which includes, I just wanted to point this out, the health order has a component in it that states that all individuals must remain prepared for shelter in place. So that is certainly a responsibility to remain prepared for sheltering in place, avoiding traveling, checking in on family members and friends to stay connected. And then all of these healthy habits, which we know will help our immune system respond to all viruses and just generally keep our bodies healthier. Reactive is after the fact, after one or more of these things have not been done and there has been an exposure. And that's where oftentimes public health is stepping in and doing the case and contact tracing, et cetera. And then our medical providers follow up with the medical treatment, et cetera. And I just like this graph or this illustration to show that none of those, all of those on those lists, none of them are completely foolproof. And so having as many of them as possible is what guarantees preventing transmission or gets us close to a guarantee. Another frequently asked question is what to do if I think I've been exposed. Please self-quarantine, even if we haven't called you yet. Stay home and isolate from other household members if you can. Monitor your health to see if you have any symptoms and call the clinic to get tested 2 to 3 days after the exposure. And just a reminder that stick staff will only call if you are named as a close contact. And just a reminder to please get vaccinated. Please don't travel, especially on an airplane, unless absolutely necessary. And to please wear those 3-ply masks over the mouth and the nose. That's it.
Dr. Cope, we have one question in the chat.
Sure, I'll take a look in there. Yep, I do not have any information on the new variant at this time, but I will certainly post on that next week.
Thank you, Dr. Cope. We'll go ahead and move into the rest of the update. No update from the tribal organization. I'll move into the Makah EOC. Just a reminder to everybody, shelter in place is for 2 weeks. It started yesterday at 8 a.m. Essential travel only for essential needs. If you need any guidance, please check on the stick.org website. You're going to hear that a couple times. When traveling, please practice all safety protocols that have been given when you're out of town or out of the house. Wear your masks, eat vaccinated or not. We will continue to harp on that for the duration of this pandemic response. I wanted to remind everybody that you can receive the regroup emergency notifications. You just have to go on to the stick.org website to register your phone number, name, and then you'll automatically receive those updates when they come out or are put out. Please do your part in this shelter in place. We know it's rough, but it's something that we have to do in order to get this current outbreak to start curving down. When you're passing through the checkpoint, please cooperate with the checkpoint staff, let them know where you're going, what you're traveling for, but be prepared to show proof of your travels. This could be receipts, electronic documents such as your doctor's slip or any medical appointments that you have to go to. Please be prepared to show that upon returning back to the reservation. And continue to check the stick.org website. It was updated yesterday morning, so there's a few of us that did work through the holiday. Those are the most updated numbers as of yesterday. We're going to continue to monitor those and post them up on the website. This briefing will be posted later on today. So I believe that's where we're at today. Just want to encourage everybody. We know it's a rough time when kids were just getting back to school, getting in a routine, but we have to take these precautionary and safety measures as of right now so we can continue on and hopefully progress here again in the near future. So I wanted to thank everybody. Dr. Cope did put a few links up on the chat box, but you can check the stick.org website. Want to thank you all for attending. Please come back next week if there's any changes or anything else. Continue to check the stick.org website for updates. We periodically throw stuff up there, but we don't send out a notification. So rely on that as one of your informational sources that you should check regularly. And I want to thank you all for attending again. Also thank the Stick EOC staff, all the preparation we've had to do, the Makah EOC staff for all the work that we have had to do. I want to thank Makah Tribal Council and especially the Makah community. So you guys, please stay safe, take all precautionary measures that you can, and we will see you back next week. So thank you.